once again, I want to thank the speakers for, the organizers for inviting me to this conference. It's a great pleasure to be among people who know about hardware and what hardware can do in relation to biological discovery and medical treatment. And what I want to do this evening, given that I've been in this field for about 40 years, is to give you the area of MRI for about 40 years, is to give you a kind of a glimpse at the major developments, or shall I say, milestones along the route that has ended up with MRI being an incredibly important tool for neuroscience, imaging neuroscience in particular. So we're starting out looking at the three worlds: the world of research physics, the world of radiology, and the world of industrial engineering. And I call them worlds because each of them has a completely different sort of ethos or structure of authority, economics, training, culture, and to make the elements of these different fields work together and create something far greater than the sum of the parts is a very interesting thing that's happened. So I'll describe this in the form of 8 breakthroughs. And one of the first is signaled by the observation with MRI of coronary arteries in adult human heart in Nottingham in 1987. And then nothing would have really moved forward had there not been dramatic improvements in gradient coil technology, also in Nottingham and in other places, from 86 to 1990. Another very important development was the building of a whole-body MRI scanner by a small startup company in Massachusetts in 1987. I'll tell you more about that when we get to it. And then the introduction of diffusion-weighted echoplanar imaging, which is a very fast form of imaging, by myself and Dennis Libihan, as a clinical modality in radiology at National Institutes of Health. And then at a very similar